One of the things that we try to do within the Innovation Accelerator, or Up Accelerators as I may call it, is try to figure out what are the next steps for these young entrepreneurs. And so we have deliberate planning with them on sustainability after the program, where we help them position themselves in a way that they're investment ready, okay? And then through our networks, we try to link them up to either potential investors or potential institutions that can further support them throughout their journey.
With innovation, we actually put the young person, who are the majority of our core work here in Uganda, to be front and center in developing solutions to challenges that affect them or their peers. So you actually move away from talking down to the young person to rather talking with them and together coming up with solutions to these challenges.
My name is Ida Bukubuza, and I am from Team Health Data Harvester, famously known as DG Health. Health Data Harvester is a low-cost open-source digital tool that enables outreach health workers advanced information integrity and service delivery in improving health data collection, visualization, and reporting. Design thinking has enabled my team and I to improve the Health Data Harvester app to fix specific needs of the outreach health workers.
Currently, we are using the HMIS books to record the data. That's the patient's info, the age, the drug we've given, and the diagnosis. It has a lot of challenges. Number one, they are heavy to move with. You take a long to write in them. After prescription, you have to record the data. You have to dispense. It's you, the clinician, doing all that work.
From the interaction we had with the users, the community health workers, we learned that they are in dire need for a solution for their data collection. They need a solution that will be helping them to be able to access the patient history and also do a proper reporting back at the hospital.
Many girls cannot afford the sanitary pads on the market. When you go to schools, you'll be surprised to know that some will miss school because they are going through their menstrual period, the 4 days of their menstrual period. They do not have the right materials to use. They are so embarrassed to be in public because they will stain their dresses and everyone will laugh at them, so they choose to stay at home. When we first started the Up Accelerate program, we had really just come out of the lab. All we had proved was that sugarcane has ability to absorb fluid, but did not have a prototype that we could showcase, or it needed so much improvement, whatever we had. So being part of the Up Accelerate program has assisted us to move from the lab level to actually improve our product.
This is still our prototype, and when it is finished, it is going to be a pad made out of sugarcane fiber. We now realize that we are supposed to produce a pad that is in different sizes, that is able to accommodate for the low flowing girl and also the high flows. And it has also shown us that we should produce a pad that is comfortable for these girls.
iDrain is a device that has been designed for low resource settings to help with pleural effusions. A couple of patients go to hospitals with lungs and the intrapleural space filled with loads of fluid, probably due to puncture in the lungs. So the iDrain is meant to help with these kind of diseases.
I came up with iDrain when I was a third year pharmacy student at Mbarara University of Science and Technology. This is because I'd lost my first patient due to excess accumulation of fluids in the lungs. From the UP Accelerate program, I enjoyed the live prototyping clinic. It has helped me plan, test, and attain detailed feedback from the end user.
As a doctor, the iDrain product will ease my general function, being that it is required in emergency settings. So I'm looking at it as reducing on the time we've been taking to work on these patients who need to be drained.
In rural areas, these people cannot access ultrasound. Reason being, these machines cannot be maneuvered well in the rural areas. Secondly, these machines are very energy intensive, and yet electricity is just a luxury in rural areas.
We have drawn the designs, and the designs are ready to be converted into a working prototype. On the side of the software right now can be able to detect sound, it can be able to draw graphs, and it's only left to perfection so that it can actually form a complete image.
UP Accelerate has helped us in the business perspective, in that now we know that we can make profit out of this and put it back into the MScan. It has helped us to know how to manage our books and given us so many resources, so many connections that will push this product forward.
To the credit of the young people, they know that to survive in the innovation ecosystem, you must be extremely innovative. It does not just help duplicating what exists and without adding any value. I know for a fact, like Outbox, they don't just give them a computer and so on and tell them innovate. You think about the problem and think about a solution that will solve that problem.
They need support to deeply understand how to empathize with their customers and build solutions for them deeply. How do I start a business? How do I appreciate what it means to build a business? And so the Innovation Accelerator brings in that approach. It brings in organization to the chaos that these young people are trying to do when they start social businesses addressing sexual reproductive health challenges.